So these sheets are for exam 1 of our parasitology 2 class. So this is going all the way from Giardia to Hepatozoons. And so our first one is going to be Giardia. Giardia is a mucosoflagellate, so that means that it has flagella and it infects the GI. Naturally, it is a commensal, so it'll only hurt you if there's something that has happened that allows it to overgrow. What's really unique about Giardia is how it's organized. So there are actually these different what are called assemblages. I mean, it's basically subspecies. I don't know why they split it up like this, but subspecies of it, and they all infect different animals. And so we have to know these. So for us humans, we can get A and B. Those are the ones that we are worried about. Okay. Your dogs can get C and D. I remember it as C for canine, D for dog, but they can also do A and B. And so technically we could get it from dogs, but it just doesn't happen often. Cats, I'll do cats first. Cats are F, so feline, and then A, because cats like to be a-holes, so we can get it technically from cats as well. And then hoofed stock is going to be your E. That one's just a wild one. So your life cycle that they go through, you or the animal or that kind of thing, we ingest this cyst that's right here. It'll go to the small intestines and then is going to change into this little troph. It's going to attach to the mucosa. It's going to feed there and sit there for a while. Eventually, they will encyst and become back to the cyst again, and then get passed in the feces. They are immediately infective as soon as they are passed. And these are also super hardy. They're really hard to kill. So pathogenesis that they have, again, like I said, the troph will attach to the brush border, and so they're sitting there on it. Of course, they're hurting those microvilli, so it can induce mucosal inflammation, impair the absorption. That's why you tend to see a lot of fat and mucus in the feces that come out of it, is because they just aren't absorbing the nutrients well. Then, of course, it can cause damage to the microbiota. So symptoms that can come with it, because it is a commensal, it can just be asymptomatic. Your diarrhea could be acute or chronic. It's going to be liquidy because, again, you aren't absorbing water. Malodorous, mucousy, and fatty because you're not absorbing things. Important to note is there's no blood because the troph isn't actually digging into the tissue, so it won't be causing blood. And then your general GI symptoms: abdominal pain, weight loss, flatulence, and dry skin. Flatulence is going to be coming from the dysbiosis of the microbiota. So your diagnosis. A lot of people recognize this one, but you don't really see this in feces unless they're having active diarrhea, because when it goes to encyst back into a cyst, this usually happens from a change in pH as they go down the GI tract. And so if it has time to sit in a different pH, it causes it to encyst into this. So you only see trophozoites if there's like fast diarrhea to where the trophozoites go too fast through the intestines where it doesn't have time to change. Anywho, to be able to diagnose it, you technically can do a fecal smear and a direct smear to see the trophs. They'll have a falling leaf motion. They're really hard to do though. You can do a centrifugal float. You would use zinc sulfate because Sheathers flattens these little cysts into be crescent shapes. They also have a snap test. You use feces for it. That one's used for acute Giardia. You'll do a float for your chronic Giardia. The only one that will actually show assemblages, like the different, if they're zoonotic or not, is going to be sending it to Antec. And if you're doing like a centrifugal float, your animals will only shed the eggs, or sorry, shed the cyst every 3 days. And so you're gonna have to like test them consecutively for 3 days to make sure that it's fully negative and that it's not just an off day. So your treatments, the clinically approved one is going to be a metronidazole. Of course, you can do other things, but it's FDA approved for dogs. It's technically not FDA approved for cats, but it is useful for cats. It's the most common parasite, most misdiagnosed. To prevent it, the biggest thing that was emphasized to us is you have to bathe on the last day of treatment. You have to get rid of the cysts that are left over. You can prevent coprophagy, You can avoid fresh water. That's the biggest thing for us, because humans are most likely to get it from beavers instead of our actual animals, and then helping that microbiome out. And then people say that dogs get like recurrent, like they stayed having the infection. Most likely they either got reinfected, or they missed the doses, or they retested too early after treatment to where all of it isn't cleared away yet. So that's Giardia. Next one is going to be our Trichomonas blackboomii. Sorry. This is known as feline trichomoniasis. Sorry. It's also a mucosoflagellate, and it only deals with cats. And the thing with it is, like, technically there is a cyst, but it's unknown. So that's why I can just go straight through cats, because they don't really know what that cyst stage is for. And so what it does is the cat will eat the trophozoite. It'll go to the large intestine, so different than Giardia. This is large intestines, do binary fission to reproduce. It'll shed its trophozoites in the feces, and they are immediately infective, and then can pass along. So what they do, the pathogenesis, they will adhere to the epithelium of the cecum and colon, so kind of like Giardia, but we're in the large intestine. So it'll cause colitis, crypt abscesses, increased mucosal production, and of course alter the microbiome. So the clinical signs kind of going to be like Giardia. Wax and wane diarrhea. Big thing is, like, it's further down, so it can hurt the anus. Fecal incontinence can cause vomiting, abdominal pain, depression, and those kind of things. It is seen more in shelter cats and multi-cats area, because of course there's going to be a higher concentration of being able to pass it through their feces. It's more common if the animal is above a year old, and it is more common in purebred male cats for some reason. So diagnosis, like I said, you're going to look for this trophozoite, and it has a very unique what's called undulating membrane that you can see. That is its infective stage and its diagnostic stage. You can find these in a fecal smear or direct. They just aren't going to do really well. So the best thing that you do for black bromide, and technically any Trichomonas, is you do an in pouch. So what that is it's basically a big culture medium where you take a swab and you get your culture, and then you stick it in the bag, observe it for 6 days, and check it each day to see if there's been any growth. And if there's any growth, of course, that means that it's positive, because that culture medium will only support the growth of these trophozoites. So to treat it, it is ranitazole, so that was something different. The problem with it is you do have to monitor it for neurotoxicity in the cats. And unlike Giardia, no metronidazole, no fenbendazole. So only ranitazole for this one, for feline Trichomonas. Okay. Next page. So those are our mucosoflagellates. So now I'm going to get into our AP complexants. So this is Cystoisospora. It is a coccidia of small animals. The definitive hosts are dogs or cats, and it is species specific, and so that's why I have a list of species down there. Your intermediate host, there is none, but there can be parentinic host of rodents. Something to note is that we can actually ID the species on these based off of the size and what host they are from. And so your larges are going to be your Canis and Felis, so that's kind of nice because your large ones are going to be whatever kind of animal it came from. And then your small ones, Revolta means a cat. I like to think of it as like cats think they're better than us, and they like to revolt against what we tell them to do. And then Ohioensis is dog. So the life cycle that they go through is a little more complicated. So your dog or your cat will ingest the sporulated oocyst, it's right there, is going to excyst. So the little sporozoites, which are each of those tiny dots that are in here, are going to exit. They will enter into enterocytes, and so from there they go through merogony, form merots that have merozoites in them. They will burst out. They can reinfect a few times, but eventually they are going to develop into gametes, so your micro and macrogametocytes. The micro and the macrogametocytes will fuse, form an unsporulated oocyst, cast those in the feces, sporulate, start over again. Okay. So what does it do? So because it is going through those enterocytes and everything, it causes destruction and it can expose the lamina propria, and that's what causes catarrhal enteritis that happens with them. And it actually is dependent on the number of sporulated oocysts of how bad this actually is. So symptoms that go with that: mucoid diarrhea, possible vomiting, weight loss, emaciation, and very rarely is going to be rectal prolapse. So when we're looking at the sporulated oocyst, this is our infective stage. It's going to have 2 sporocysts, so that's our bigger circles in the middle, with 4 sporozoites each. Then your unsporulated oocyst, it just kind of looks like a big football with a circle on the inside of it because it hasn't split into these 2 yet. So treatment is unique for these. You use sulfadimethoxam, which is your Albon, but the label doesn't say it's for, sorry, that's not supposed to be, yeah, it is. It doesn't say that it's for coccidiosis or cystoisospora. It says it's for bacterial enteritis that is associated with it, so that's unique. Technically, you can do finasteride. Big thing, no metronidazole, again. So to prevent, hygiene, cleaning, fecal disposal. They're pretty hardy as well, so that it can be hard to clear it. Toxoplasma gondii. Definitive hosts are cats. Intermediate hosts / parentenic hosts are humans, rodents, and really cats. And I have the slash there because technically they don't need the intermediate hosts to keep passing. Cats can pass it to one another. So how does they pass it? So ingestion happens, and this is kind of, I had messed up when I drew this. So this top part is cat, this bottom part is like an intermediate host. Technically there's an arrow that goes that way. So your cat will ingest the sporulated oocyst, undergoes merogony in them, undergoes gametogony in them. This is all in the intestines, but it doesn't cause any damage in them. The micro and microgametocytes will fuse. They shed the unsporulated oocyst. They sporulate. It could go to another cat, or it could go to us or an intermediate host. Here, they invade the intestines, cut through it to reach into our blood. There, the sporocysts become tachyzoites. Tachyzoites are causing all the trouble, causing all the damage, freaking out. Eventually, the immune system catches up to the tachyzoites being present and starts attacking them. And they're like, oh crap, we need to hide. So they will go and hide in usually like the muscle and those kind of things as bradyzoites, and they sit there until eventually either they get eaten again. So cats can get it from either ingesting sporulated oocyst or ingesting tissue cyst as bradyzoites. And so I don't really have pathogenesis because in cats, usually because they're the definitive host, it's not causing damage. Like I said, it's asymptomatic unless they're immunosuppressed, and then your cat will have the same pathway as the intermediate host. And so if they are acting as the intermediate, there's going to be fever, depression. It could go to the eye, uveitis, behavioral changes. That's a big thing with Toxoplasma gondii because it can go to the brain and just sit there. Pulmonary and hepatic disease. Diagnosis, you can do a fecal float and look for those sporulated oocysts or unsporulated oocysts. The thing with cats, though, is they only shed it for 2 weeks at a time. You can also test for antibodies, which is useful in both the cats and humans. And I know we haven't taken immunology yet, but a key way to remember it is that your IgMs are like your first antibody that responds to a disease, and it doesn't last very long in the body. So if IgM is present, that means that it's currently responding to something. So that means that it has to be a current infection. IgG, I remember G is gone, like the disease was there and now it's gone. So it's kind of a memory thing of like, it's gone, but I'm going to remember it in case it comes back. So that means that a prior infection happened. The animal has built up immunity. It's not going to get a second bout of it. So treatment for your normal cats, there's none because it doesn't hurt them. If they are symptomatic, you can do clindamycin, so your antibiotics, trimethoprim, sulfonamide. Yeah. Prevention, remove feces within 24 hours because it takes 1 to 5 days for the oocyst to sporulate. If you find a cat that is shedding and your owner is pregnant, you can keep the cat at your clinic until they finish shedding, just to protect the owner. Then you can, of course, prevent the cats from scavenging to eat those bradyszoites. It is zoonotic. How we get it is we ingest a sporulated oocyst, and it actually doesn't really hurt us. It'll make us have like flu-like symptoms and just feel kind of crappy. But the reason why it's so scary is the damage that it can cause to fetuses when someone's pregnant. And so I had to learn all the different ways that it damages. But the biggest thing to know is it'll cause fetal abnormalities. So that's why it has on here like remove feces within 24 hours. As long as like a pregnant woman isn't cleaning the litter box herself, and her partner will clean the litter box and get rid of all of that before they sporulate, then they're going to be fine. Okay. Next is Neospora caninum. It's kind of like Toxoplasma, but for dogs. So the definitive host is going to be your dog. It'll shed, that's what sheds the oocyst. And instead of like us, the intermediate host is cattle. But just like humans with Toxoplasma, what happens here is in cattle, it causes abortion. So it causes those fetal abnormalities again. So there isn't really much about the life cycle for us to know. The biggest thing was like dogs get infected by either eating a tissue cyst or it goes transplacental. Cattle get it by ingesting a sporulated oocyst that was passed through the dog. Diagnosis, it takes 1 to 3 days, kind of like Toxoplasma, for it to sporulate. And so you could do a centrifugal fecal float. The only problem is there is a species called Hemondia that looks exactly the same as it. So that could just make it confusing. We'll get back to the puppy part that's right there. So clinical signs, if the dog is healthy, and an adult dog, then it's fine. But like I said, it can go transplacental. If it goes transplacental, it causes this thing. Polyradiculoneuritis myositis syndrome. Big words. The biggest thing, neuritis, that's in there. It causes necrosis of the brain, spinal cord, and nerves. It just tears up that nervous system. So you're going to have your lower motor neuron deficits. And so we learned motor neurons help with tone and those kind of things. So you're going to have ambulatory issues, is the point. And so if you see a puppy with these kind of deficits, they aren't passing the sporulated oocyst, so you have to look at signs. You might have to biopsy them, do a PCR or serum test to see if they are showing that they have Neospora caninum. Treatment. The problem with this is you will never actually get rid of the infection, but you can stop further progression in these puppies. The damage is already done. So you can do clindamycin, pyrimethamine, and sulfadiazine. So it's kind of very similar to Toxoplasma gondii. They have similar treatments. And like I said, cattle's, it'll cause abortion. So to prevent the spread of it, just don't allow the dogs to eat the fetuses and placentas that come from aborted fetuses from the cattle. Okay, and then this is our last Sarcocystis cruzi. Just ignore that. This one, the definitive host is again canines. The intermediate host is again cattle. They get infected the exact same ways, except it's not transplacental here. So dogs have to get it by ingesting a tissue cyst. Cattle have to get it by ingesting a sporulated oocyst. It doesn't cause any damage in the dog. The damage is all done in the intermediate host. So there's no clinical signs. You technically can do a centrifugal fecal float, but you don't really need to for them. There's no treatment. Don't let them eat the raw meat and carcasses on farms so that they can ingest a tissue cyst. I added this at the bottom because this is how like your mosquitoes and those kind of things can spread as vectors. Stercorium means a bug bites. And a lot of times when bugs bite, they just poop for some reason. They bite and they poop, and in the poop is where the parasite is. So that poop just gets in the skin wound. Salivarian transmission is exactly what it sounds like. Bug bites, saliva has the parasites in it. So, my next page. Okay. Trypanosoma cruzi. So this is Chagas disease is what it's actually called. Humans can get it, but we have to get it from the reduvid bugs, just like the dogs and cats do. So we are the definitive host, so are dogs and cats. Intermediate host is reduvid bugs. They're also called kissing bugs. It is located around here, so that's important to note. It's technically further down, like that's where it's supposed to be endemic, but it has been seen here. Life cycle that it goes through. So it spreads through Stachorian transmission. So the kissing bugs will bite, poop, and the poop is what contains the parasite. So that's what it says here. The infective stage is what's called a trypanomastogote. So the poop has the trypanomastogote. It goes in and it goes to the macrophages and the cardiac cells. So a lot of what's with Trypanosoma cruzi is going to be heart issues, right, Toby? They're going to turn into mastogotes. They can rupture, cause damage. Eventually, they're going to turn back into trypanomastogotes. I don't know why. And then when the bug bites again, they can ingest red blood cells. They can ingest the trypanomastogotes that are just floating in the blood, and the cycle starts over. So there are 3 different phases that go with Trypanosoma cruzi. It's the same in humans, actually. Your acute phase, I just consider it's a lot of heart symptoms: weak pulse, arrhythmia, enlarged lymph nodes because it's infecting those macrophages, sudden heart failure. If they make it through that acute phase, they might have some hepatosplenomegaly and those kind of things, but they'll go into a latent phase of a little over half a year to 3 years. And then at the after that, they're going to have progressive, even worse heart signs, and they'll be dead within 9 months to 5 years of that initial acute phase that they were in. So, diagnosis, it can be hard because it deals with blood. You can take a history and clinical signs. You can examine, you can look at radiographs for how the heart looks, imaging, anything echoes to look at the heart. You can technically do a blood smear, but the problem is you have to catch it when a trypanomastogote is actually active and is ruptured out. You can do a biopsy to find a mastogotes, PCR, immunofluorescence, and those kind of things. There's no treatment. Do pest control for those reduvid bugs, prevent predation, and then, of course, don't transfer it through blood transfusions. Leishmania is kind of similar. It also does your amastogotes and trypanomastogotes and those kind of things. It is not found here in the U.S. except for one species, which I'll get to. So dogs and humans, because this is zoonotic, but we have to get it through the sandflies. The sandfly bites us and gives us a promastogote. That's what infects us. And then it turns into trypanomastogotes and amastogotes and those kind of things. So that's what I was talking about. Here in the U.S., we have foxhounds that will pass it through vertical transmission, so transplacental, and they pass it via amastogotes. So that's the infective stage for our foxhounds. Clinical signs that they'll have: your skin, you'll have dermatitis, hyperkeratosis, spectacle hair loss, so skin's not happy, ocular uveitis, keratoconjunctivitis, not happy, polyarthritis, hepatosplenomegaly, fever, anemia, cachexia, just totally systemic, not good things. Diagnosis, you would have to either look at the travel history to see if they've been to these areas or the breed, the foxhound, or you can look at serum. And again, no approved treatment. Yeah, there's not one about this one. So then these are our blood AP complexants. So some things to note before I talk about species specifics. All of the ones that I'm going to talk about are vectored by ticks. So we had to know some things about them before we can understand the diseases. So sporogony, that's where they make the sporozoites, happens in the bug. Same with gametogony, happen in the bug. Only merogony is in the host. And the other difference that I keep messing up, our definitive host is our bug. Definitive host is the bug. Intermediate host is our pets, our animals, those kind of things. So remember, intermediate host is usually where damage is caused. That's why these diseases make us so sick. Definitive host, bug, okay? There's 2 different ways in ticks as well that they can pass on the parasite that they are carrying. So transovarian means mom passes it to all of her babies. Transstadial means that, let's say baby gets it, it'll continue to stay with them as they develop into a full-on tick, which I mean, there's a nymph stage and a larval stage and whatever, but it'll go through all the stages with it. So the first one is Babesia. It is vectored by Rhipicephalus sanguineus tick. That's the brown dog tick. So B and B, brown dog tick, goes with Babesia. An immediate host is going to be our dog. And again, there's multiple species. Biggest thing is like your canis. Canuses are your large. Gibsoni is your small. And this Gibsoni is special because here in the US, it's actually not vectored. There's no bug, like it's not vectored by this brown dog tick. It actually spreads via blood. But then Canis and Vogeli will spread via the brown dog tick. So its life cycle, the tick will bite, deposits its sporozoites. It'll go into the red blood cells. There it becomes merozoites, and it looks like a puroplasm, which is right there. Little triangle pieces in the red blood cell. Burst out, could infect more. The tick will eat the infected red blood cell, and then it'll go through all of its stages. Babesia in the ticks can do both transovarial and transstadial, so both of those examples that I talked about earlier. It's not zoonotic, so yay, there is technically a Babesia for people, but it's not either of these species. So pathogenesis, because it's in blood, it's going to act systemic. It's destroying red blood cells, so anything that you can think of with like red blood cell destruction, anemia, your heart's going to try to speed up to catch it, those kind of things. Tissue ischemia, because it's not getting all the oxygen it needs. It causes intravascular coagulation or intravascular hydrolysis. That was a thing that was on our quiz. Disseminated intravascular damage. Clinical signs, if it's not that bad, you'll just have anemia because it's still rupturing those red blood cells. Complicated, so thinking of like it's been doing it for a bit. Lethargic, weakness, hepatosplenomegaly, fever, pale mucous membranes because there's no oxygen, tachycardia, low blood pressure because the biceps is freaking out. B. Gibsoni, the small, is a little different. It just is chronic, and it'll have a transient fever, which means like it waxes and wanes. Intermittent. Diagnosis, I talked about this puroplasmin that will be in the red blood cells. So you can stain and look for those. You can do an antibody titer. PCR is probably going to be your best one because you aren't necessarily guaranteed to see those. And then for like your Gibsoni, because it's spread through blood, your fighting dogs or hunting dogs are more likely to get it. So your treatment, the main one to remember, is the FDA approved for our Canis and our Vogeli. It's imidacarb dipropionate. So imidacarb dipropionate. That sounds better. FDA approved. That's the same as for hepatozoon. So that's an important one. Small, you can do the A's and A's, but because it's not FDA approved, we don't need to know it. Prevention, tick control. Don't fight your dogs. Give it preventatives, your ascorbyl drugs, which are isoxazole, that word. I'm so sorry. So Cytozoan felis is kind of like Babesia, but in cats. So it is vectored by the Lone Star tick, which is also known as Amblyomma americana. It's technically an intermediate host is the bobcat. That's why it's called bobcat fevers, but our domestic cats are kind of just like a paratenic host. It wasn't initially intended for them. It's not zoonotic, yay. So their life cycle, the tick bites, and it inserts the sporozoite, goes to the macrophages, causes merogeny, ruptures, then goes to red blood cells, also forms a puroplasm. So the only way you can tell the difference between Babesia and Cytozoan felis is if they say this is from a dog, this is from a cat. So tick again eats the red blood cells, sporogony. It will go transstadial, so through the different stages of the tick, but it will not go transovarial, so a mom cannot pass it to its babies. What it does, again, systemic, causes large macrophages, so it can include your blood vessels, tissue necrosis, damage to the lungs, those kind of things. Causes depression, lethargy, anorexia, high fever, icterus, anemia, all the same things that we saw with Babesia. So this is just in a cat. Diagnosis, again, could see in a blood smear, could do presumptive PCR. That's the best thing. Same with Babesia. PCR is the best thing. Treatment is our double A's, ativaquone and azithromycin. Supportive care, The biggest thing is like it's almost 100% mortality if you don't treat it. I think with treatment, it's only 64% mortality, which is also not good, but so double A's, ativaquone and azithromycin. Prevention, just give them preventative. Hepatozoon. Okay, there's 2 different species of hepatozoon. So Hepatozoon canis is old world canine hepatozoonosis. It goes to neutrophils as is white blood cell, which I'll talk about when we get here. Hepatozoon americanum is the American canine hepatozoonosis. It goes into macrophages. So they have different ticks that vector them. So your Hepatozoon canis has the brown dog tick. So if you remember, Babesia canis also does the brown dog tick. So I just remember canises have brown dog tick. Remember, Hepatozoon americanum goes to the Gulf Coast tick because the Gulf of Mexico was just changed into the Gulf Coast of America, or the Gulf of America. So I remember americanum goes with Gulf. It's not zoonotic. Our dogs are the intermediate host, our life cycle. This one's unique where the dog has to fully eat the tick. Can't just get bit, it has to eat the tick. Sporozoites are released. They enter leukocytes, so that's what I was talking about. If it's canis, it'll go to neutrophils. If it's americanum, it'll go to macrophages. Goes to the tissues, merogony, gametoogony. The tick will eat it, starts over. Again, just like Felis, goes transstadial, but not transoviral. Will not pass from mom to kids. What does it do? So when it goes to its tissues, it'll form what looks like an onion skin cyst. It looks like an onion. What this is that it's sitting in the middle, and then it is surrounded by mucopolysaccharide, and this induces granulomatous myositis with atrophy. Basically a whole bunch of not happy. And that can also induce more bone proliferation, which is that painful bony exocytosis. So signs, fluctuating fever, that just won't go away with antibiotics, ocular discharge, hyperesthesia, so it's like chronically painful, stiffness, stilted gait, because again, painful bony exostosis. Canis is a little separate, so this is kind of your americanum. Canis, you need a higher worm burden to actually cause disease, and it will not cause any of that pain that's associated with the exostosis. Diagnosis, you can look at presumptive. You can do radiographs to look for that extra bony growth. Muscle biopsy for the those onion skin cysts. Blood smear, PCR, probably still the best thing. So americanum, there's not an approved drug. It'd probably be pronazaril that is then followed by decaquinate. The problem is that it does have to be lifelong treatment. And then you can treat the pain, but it has to be non-steroidal because steroidal will actually encourage further growth of americanum. Canis is actually unapproved. It is FDA approved. So I was talking about this with Babesia. It's the same thing, imidacarb, dipronate, but then with these you will follow with doxycycline. Prevention, tick control, don't let them eat like rodents and those kind of things because they technically have paratenic host. So that's it for exam 1.